Most people over 60 bang out a few squats or deep stretches the second they get out of bed to wake up their knees. Why is that the exact trigger that destroys your cartilage? Here's the reality. Your joints wake up before your synovial fluid does. After 8 hours of stillness, that fluid gets thick, like a jar of honey you left in the refrigerator. Heavy, sticky gel. The second you stand up and load your full body weight onto it, you're forcing a dry joint to go from 0 to 60 with no warning. Quick test. Next time you wake up, stand up slowly and pay attention. Stiff? Almost locked? Taking a few awkward steps before things start moving? Waiting 10, 15, maybe 20 minutes before the pain eases up? If any of that sounds familiar, grinding through it is only making things worse. And honestly, nobody ever told us any of this. So here's what I want to show you. I call it the knee ring, a solution I learned from traditional Chinese medicine. It targets 4 specific spots that get that fluid circulating again. Points that carry serious clinical value. And I'm not just saying that. A brand new 2024 clinical trial, peer-reviewed and indexed in the same federal database American doctors use every day, just confirmed these exact protocols produce measurable reductions in the biological markers that cause cartilage breakdown. Centuries of use, now backed by modern science. Not much effort, no tools, you don't even have to get out of bed. Most of my patients feel a difference the very first morning. Stick around until the end. I've got a small gift for you, a simple 3-minute routine to lock it all in. One heads up, if your knee is hot, visibly swollen, or you can't bear weight, see a doctor. But for everyone else dealing with that rusty morning feeling, try this. I'm Dr. Grant, and this is Lazy Senior Tips. Let's get into it. 4 hidden buttons. All right, let's get into the biological control panel. You're going to spend about 45 seconds on each point. You can use your fingers, especially your thumbs. The technique is simple. Rub in firm, small circles. Now, here is what you need to look for. A good, deep ache. You want it right at the edge of what you can tolerate. That's the signal that the nerve is actually responding. Not too hard, not too soft. Just right. Okay, we're going to start with numbers 1 and 2. Think of these as the twin oil ports. Find your kneecap. Right below it, on the bottom left and bottom right corners, you'll feel 2 soft little divots. We call these the eyes of the knee. Let's do this together. Place your thumbs in both divots and start rubbing for about 45 seconds. Feel that ache? Check this out. Stimulating this point helps improve circulation and reduce tension around the joint capsule, getting things moving again. You are manually pumping lubricant directly into your dry shock absorbers. This is exactly what drives significant pain reduction in patients 60 and older within just a few sessions. If you don't feel that ache, the effectiveness is going to be very low. Now, why do we call them the eyes of the knee? Well, when you bend your knee slightly, these 2 divots look exactly like eye sockets on the face of your joint. In traditional Chinese medicine, these were used for knees that were stuck or frozen. So the ancients gave them a name that was easy to remember and pass down. Next up is number 3, the main fuel valve. Move to the inside of your thigh. Measure exactly 3 finger widths up from the top inner corner of your kneecap. Press in there. Now, if your knees are in bad shape, this spot is going to be very tender. This is your fuel valve. So what does this do? Stimulating this point flushes highly oxygenated blood down into the joint. It helps wash away the inflammatory buildup that accumulated while you were sleeping. Here's what I find remarkable. Researchers went through 46 separate clinical trials and found this exact point showing up in over 60% of all knee pain protocols. That's not tradition. That's a pattern that keeps proving itself. In TCM, this is point SP10, or the sea of blood. Think of it as a central hub for all blood flow around the thigh and knee. Rubbing this spot is like stirring up stagnant water or clearing a clogged pipe. It gets the life force moving again. Finally, here is one more interesting point I want to share with you. Number 4, the master reset switch. To find it, go 4 finger widths below your kneecap. Then slide your finger along the sharp edge of your shin bone and drop 1 inch to the outside, into the meaty part of the muscle. That's your spot. This is one of the most well-documented acupressure points in all of medicine, not just TCM. Massaging this spot wakes up the muscles supporting your entire knee, dials down the pain signals, and gets things moving properly again. Press in there with me while I tell you why this is so cool. In TCM, this is point ST36, and here's why it works. You're pressing directly into the nerve cluster that controls the inflammatory signaling in your lower leg. You activate this, the swelling dials down, the pain signals quiet, and the joint starts moving the way it's supposed to. Now, look, you need to feel a bit of an ache for this to actually do anything. If you don't feel that deep, tender sensation, you're missing the spot. We're not just rubbing skin here. We're trying to wake the joint up. You're looking for that good ache. Go through 2 full rounds of these 4 points on both legs. Don't skip a side. By the time you're done, your knees should start feeling warm and a little more loose. That's exactly what we're after. Once you've finished both sides, we need to actually get that fluid moving. Let's walk through the 3-minute routine you'll do before you get out of bed. All right, now that the fluid is moving, don't put your feet on the floor yet. Stay horizontal. Follow this 3-minute sequence while you're still in bed. First, we're going to get the blood moving in your lower legs. Take about 60 seconds for this. Lie on your back and bend your knees slightly. Now pump your ankles up and down, like you're pressing a gas pedal, around 30 reps. This works because your calves help pump circulation back up the leg, clearing out that morning stiffness before it sets in. Next, we need to wake up the muscles that actually support the knee. Grab a rolled up towel and slide it right under your knee. Press your knee down into that towel and squeeze your thigh hard for 5 seconds. Relax, then repeat 10 times. What we're doing here is firing up the VMO. That's the specific muscle that keeps your kneecap tracking straight. Think of your kneecap like a wheel on a rail. If that muscle is asleep, the wheel drifts off track and grinds the second you stand up. This isn't a theory. The American Academy of Podiatric Sports Medicine identifies VMO weakness as one of the 3 primary causes of knee pain in older adults. 3 causes. This is one of them. And it's the one you can fix right now, lying in bed. This wakes it up before that happens. Finally, let's get that fluid distributed. Keep your heel on the mattress. Slowly slide it up toward your glutes, then back out. 10 reps. This motion is how you actually coat the joint surfaces with that fresh fluid before gravity gets involved. Now you're ready to stand up. No wincing, no grabbing the nightstand for support. Just a smooth, easy start to the morning. Look, the goal here isn't just to get through the morning. It's to stop thinking about your knees entirely so you can actually enjoy your day. Give this a shot for the next 7 mornings. No excuses, especially since you don't even have to get out of bed. If you want a simple cheat sheet of these 4 points and the 3-minute routine to keep on your nightstand, just drop a comment below saying knee ring, and I'll send it right to you. I'm Dr. Grant, and this is Lazy Senior Tips, because staying mobile shouldn't have to feel like a second job. Walk easy.